Welcome to the Getting Down with Digital Health podcast, sponsored by Mend. We hope to inform and inspire you on a wide variety of healthcare topics. We're grateful you're joining us today. And now, on with the show.
What up, everybody, and welcome to another episode of Getting Down with Digital Health. I'm your host, Brandon Worley, and joining me today, as always, is my fellow co-founder and CEO, Matt McBride. Matt, what's up, man? How you doing?
Doing great, Brandon. Great to be here.
Good. We are very excited about this episode today because we have some very special guests with us from the Grace Medical Home. Joining us today, we have Stephanie Garris, the CEO, but we also have Liza Baradona, who is the front office manager of Grace Medical Home. So, Stephanie and Liza, welcome.
Thank you. Great to be with you.
Stephanie, we would love, if you wouldn't mind, just sharing with the audience a little bit about Grace.
Yeah, thanks so much for the opportunity. It's my favorite subject matter. Grace Medical Home is a comprehensive medical practice for the low-income uninsured right here in Central Florida. We're a local nonprofit that came about in 2008 because there was a huge community need. We saw that people in our community weren't able to access primary and preventive care or ongoing care because of their insurance status or cost barriers. And we wanted to fill that gap of having a medical practice, a clinic, just like your doctor's office, where the low-income uninsured can go again and again as often as they need to get well. And that's exactly what we did. We opened our doors in 2010, coming out of the Great Recession as a privately funded nonprofit. It's been just a wild ride ever since. So we are a comprehensive medical practice, and we have primary care, preventive care, but also specialty care. Our model, because we are that medical home, we employ a clinical staff of physicians and nurses to do primary care, but then we have lots of volunteers. We have more than 500 physician volunteers. Most of them are retired, and they come to give back to their community and to see patients and to practice medicine the way they were taught in medical school. And so right here on site, we offer 35 specialty clinics. So, you'll come for your primary care visit, but then the doctor may say, well, come next week. Let's see the endocrinologist, ophthalmologist, orthopedist, cardiologist, gynecologist. It goes on and on and on. 35 specialty clinics to do that comprehensive whole patient care. And our patients are so grateful. So our patients are housekeepers, theme park workers, retail, maybe they're taking care of parents or young children, things like that. So our patients, to qualify, our patients have to be living at or below 200% of the federal poverty level, which for a family of four is about $50,000, and they can't have any insurance. They can't have Medicaid. They can't have the Affordable Care Act. We do a very rigorous screening to become a patient, and if they have another source, if they have a reimbursement source, then we enroll them or help them enroll in different insurance programs. But there's still a huge gap, 180,000 people in Orange County alone. Remember, we're a non-Medicaid expanded state. So you still have, a gap where health insurance is just not attainable for many people. So that's who we are. We're open 5 days a week, just like your doctor's office, same day sick visits, and really outstanding care.
Stephanie, that was a really great introduction overview of Grace Medical Home. Thank you so much for that. And Matt, if you wouldn't mind, just share with the audience how our paths crossed with Grace and how fortunate we are to be a partner of theirs.
Yeah, so a number of years ago, back in 2018, one of our sales representatives, I was aware of Grace Medical Home. I had been to a fundraiser event, and so I knew Grace Medical Home. I knew the story and the mission and what they were doing, and one of our sales reps, I think, bumped into somebody from Grace at church, and the kind of came into the office one day and said, why don't we donate our platform to help out Grace Medical Home with, digital forms and maybe some other things. And so I said, yeah, that sounds like a great idea. Let's give them the software, and it seems like a great way to have an impact and make a positive impact in the Central Florida area. And I think, from there, that kind of started a whole cascade of things that were really helpful to the patients of Grace Medical Home.
Yeah, not only to Grace patients, but really to other free or charitable clinics in the entire state of Florida. Because when we got that call and such a kind and generous donation, we had to make sure that we could take advantage of a state law that provides very comprehensive malpractice protection. It's a Good Samaritan statute. I talked about it, over 500 clinical volunteers. Well, they all use that protection. It's called sovereign immunity, and it's been state law since 1992. Florida has the strongest Good Samaritan protection in the country, and it's a wonderful law, but it does have very strict administrative features and functions that must be followed. So one of that is that every time a patient comes for their appointment, a form has to be signed. And technically that form is that person giving up their right to sue that named individual. Because one of the best features of the law is that if a malpractice suit is brought against somebody in the free clinic setting, all the named clinicians are dropped, and they are actually suing the Department of Health. And the Department of Health has strong in-house lawyers, and it caps damages. So there's never been a lawsuit against a clinician in a free or charitable clinic setting. And there are 110 of us in the state of Florida. There are 110 free or charitable clinics that serve Floridians, low-income, uninsured Floridians. Well, that law and that specific form that I talked about, where the patient has to sign before every patient appointment, we didn't have clarity or guidance from the Department of Health that an electronic signature would be sufficient. And, come on, it was 2018, right? But it just hadn't been updated. There hadn't been guidance about electronic signatures. And so they were in the middle of issuing rules and promulgating rules. And I had to go to Tallahassee actually and pound on some doors and talk about, that this should be permissible. And there's a way to timestamp it so that that the signature was obtained before the visit and so forth and so on. So that took a while to work through the process, but it worked. And we finally got their assurance that an electronic signature would be sufficient. Electronic transactions of this form were permissible, and then we were able to really start to customize it and talk about how we wanted to implement it in our clinic. But that took 6 months to a year of working through that regulatory mess. But yeah, it was great. It was incredible. And then what happened is we were moving into our building. We were under a massive construction project in our building. Our building is just north of downtown Orlando, very close to Mills and Colonial, that intersection. And so we were in the middle of renovating a building. It's 19,000 square feet. It's a beautiful building, a clinic, big clinic, adding dental and so forth. And so we toured Mayor Demings. He had not seen our facility, and he was excited to see that we were moving into larger space. And I was with their health person, and sort of at the end of the tour, the mayor said, I'm so glad you guys are going to be in this space, and I'm so thankful we can support you. Well, we're big fans of Orange County government and things like that. But the reality was they weren't supporting us. And so I kind of pulled this health person aside and I said, well, if the mayor's interested, we'd love some support, from the county. What does that look like? And they said, well, we would love to talk to you. What you're doing is commendable. And so let's talk to you. Well, you can imagine that took a long time of, talking with the county. And I said, well, what are the priorities of the mayor? And they said, well, he really is interested in telehealth and whether telehealth, is an option for a very disenfranchised and vulnerable population, which is who we serve. And could they use telehealth the way, it's available to people with greater means, things like that. So that was amazing because one of our struggles with launching Mend was the time that it would take to do the scheduling and to make sure these forms were filled in advance and things like that. And so when the mayor said that was a priority, that was our answer, was that we could get a position funded to help us up at the front desk. And I will be very candid. I thought that was just going to be sort of a one-time grant, and then we would assume that position in our operations. They've funded it every year in perpetuity. So the ability to have Mend, to have a platform where we could immediately say, yeah, we can do that priority. We can look at that. We're ready to go as long as, you can help us fund a position. So we were able to leverage the gift of Mend to hard dollars through Orange County government. And it's incredible. So it is being funded by Orange County government year after year, which is amazing. And so then we hired someone. We hired actually the second patient we ever enrolled at Grace. She was a patient for a couple of years. She went on to get a better job. Her health was stabilized, got a better job, didn't really like it. She originally was a housekeeper and she had developed asthma and things like that and some health complications, and then was our patient and then went on and got insurance, but didn't like the job. And so when we were hiring for this telehealth position, she interviewed and is amazing and is one of our staff members to date. So with her on board and with customizing all the documents and getting clearance from the Department of Health, we said, okay, we're going to do this. This is so exciting. And do you know that our go live date was March 1st, 2020? And then this little thing called the pandemic shut everything down. And we were good to go. We were good to go. We'd had the training. We knew the scheduling. We had the people. We had the forms. We had the legal protection. So it really is just an extraordinary God sighting, as we call it, a story about just providing so much more than we ever asked for or thought we needed.
Stephanie, that is such a wonderful story. We have to commend you because we know all of the diligence and the effort you had to put into getting the signatures approved, working with the mayor, all of those hurdles that you had to jump over. It's nothing short of astounding. So congratulations on being able to accomplish all of that.
Thank you.
Liza, we all know COVID, right? That tested all of us. Liza, I would love to hear from your perspective how just kind of the onslaught of COVID and the patients that you're serving and the clients you're serving, what was that like for you?
So definitely Mend was a godsend to us. There was a lot of volunteers that couldn't come in, because they were compromised, health. And so we were down to mostly staff. So our front desk staff actually got on the phone with patients and said, you need to download to your cell phone this Mend app. So we got on the phones. We told the patient, go to your Google or to your Apple store and download the Mend app. We ran them through. They got logins, and we were able to get the doctors actually into Mend and teach them how to use Mend so that they could see their patients, which was amazing. In a time where the pandemic, where everybody, was scared and for the patient, it was amazing to actually be able to still see their doctor. They would get so excited, they were seeing their doctor on the other end of the screen, and they didn't need computers or they didn't need a tablet, because a lot of our patients will have a phone. They might not have a tablet. So most people nowadays have a cell phone. So we were able to use this platform with just, their cell phone, which was amazing. And till this day, we actually use it. I think I have Rosa on, at the front that she's on Mend all day, just sending the forms, sending the affidavits. And so she sends all kinds of forms to the patients. And if there's a patient that's new to Mend, she actually goes through the whole process and helps them, set them up. We actually started last year, we had 1,223 telehealth visits. This year, actually until from January to today, we had 2,410.
Wow.
So that's double the visits.
Wow.
Telehealth.
So you just kind of led to where I was going to go next. Obviously, COVID just forced you to have to scramble and really implement telehealth right away. But can you talk a little bit about how that doubling happened? How does the way you care for patients now, just how has telehealth become a part of it? How are you deciding who's going to receive telehealth, who isn't going to, just kind of talk a little bit about your workflows?
So basically what happens if when patients come in and see their doctor for their chronic visit, and we used to have we still have a lot of what we call rechecks. So the doctor just wants to recheck on the patient, follow up on just a quick visit on, how is your medicine working that I gave you 2 or 3 weeks ago? How is that working? So instead of having the patient drive all the way here, take off work, or possibly, just take the child out of school to get here, we just tell them, listen, we're going to do a telehealth visit. We're going to schedule telehealth. We're just going to check on you real quick. You don't have to drive over here. So it's come very, very handy because a lot of our patients have a hard time getting off work, or the kids are in school. So the parents are running around, between schools and getting their kids. So it's come very, very handy because a lot of our patients also have to pay somebody to get them here. So in that case, they could do it from the comfort of their home, or at their lunch break. We have patients that have taken their lunchtime around the appointment time so they could get on Mend and see their doctor. So it's been a huge, huge blessing to our patients.
So it sounds like, in just what you said, some of the obstacles, whether they have to pay for transportation, they have to arrange for childcare, may have to leave work. It sounds like by kind of eliminating some of those obstacles, is it safe to say that your no-show rate has decreased very significantly and you're able to care more people?
Yes. Yes, most definitely. Most definitely. As a matter of fact, a lot of patients, if they have trouble getting off work or they can't get here because of transportation, they will call and they say, can we do a telehealth instead? I was supposed to come in. Can we do a telehealth? So we start, rolling off get the forms going, send it to them. They sign it off, and then, we schedule them in Mend. So yeah, it's been very, very convenient, and our patients love it. They just love it.
Yeah, and let me just elaborate if I can. We have about 1,300 unduplicated patients, but they come on average 13 times a year. Only 3% of our patients have ever had a doctor's office. If they've sought care, it's been very episodic at an urgent clinic. It's to treat whatever that urgent issue is so that they can get back to work. They haven't had the preventive, the primary, the chronic disease management. So, 13 times a year, they're very complex, very medically complex. So that's a lot. 13 times, those are medically necessary appointments, but the ability to offer some virtual where they don't physically have to be here is a game changer. It's a game changer for them. It's a game changer for having them understand why it's important to take the meds or whatever the issue may be, continue on the physical therapy. I mean, we've done Mend appointments for so many of our different specialists, and it really has benefited our patients tremendously in terms of patient education and compliance.
That's so exciting. Matt, I know you have some questions that you'd like to talk about. I know one of them is centered around the FCC, but there may be some others as well.
Yeah, Stephanie, I know you were actually visited by some high-profile folks from the FCC, but the FCC has, we've worked with customers that have received grant funding. Maybe talk about the FCC visit, what the process was like for grant funding. That might help other organizations like yourself or some of the other ones that are treating, that need funding because they're treating important populations.
Yeah, it was incredible. And another example of, how a gift of a platform that you all made was again leveraged for hardware and equipment. I mean, it's just unbelievable. So when the pandemic happened, that we have to privately raise every dollar that we spend. And I have a $3.5 million budget. So that's a lot of money. We are statutorily prohibited from any third party billing, right? And healthcare is expensive. And so, so that's a lot of money that we have to raise. So when the pandemic happened, I was terrified. I didn't know what would happen to our donors. Would they lose their jobs? What was going to happen? Our events were canceled. We knew we wouldn't be able to do any fundraising events and things like that. Now, thankfully, in healthcare, we were able to qualify for some COVID money that was becoming available. But I'd never applied for a federal grant. And then the FCC, had this money for telehealth and for equipment. And so we applied and had to, trial by fire. These aren't the easiest things. We had to get a lot of, our DUNS number and things like that we didn't really know what that was, but went through the process of, federal procurement, regulatory compliance issues. And we got, I think, around $40,000 for all new computers and things like that. And so that was incredible. But I was able to talk right away how we have the platform, we have it in place, but we need more hardware. We've got to, and Liza said, as she said, a lot of our volunteers, they were high risk. A lot of them was because of age. They were retirees and they wanted to still serve. They were concerned for their patients, but they weren't going to take the risk of coming in the clinic. Well, to be able to say, we can bring you a laptop and, it's secure and things like that. And we had telehealth. It was certainly made our grant compelling and we were awarded the funding. And probably 6 months later, I got a call saying that Brandon Carr, the head of the FCC at the time, wanted to come to a site visit. They wanted to come to some agency or clinics that they funded, and they chose ours. So with some nice press, and he came and toured my clinic, such a nice guy. But I have to laugh. I mean, never in my wildest dreams would I have thought, the first high-ranking federal official to, come see my clinic was going to be from the FCC. But there you go.
That is actually funny because I happened to go see him myself. It was like 2018, 2019. They were starting to craft some of the telehealth funding that they were wanting to do, specifically around rural areas. And I was invited to his office to go spend some time with him and share our views on that too. So kind of a small world and how it works out. And he is a very nice man. I know this has been a very heartwarming experience for us at Mend to be partnered with you guys and all the wonderful work that you've been doing. Matt, any last questions before we wrap this up, or Stephanie or Liza, anything else you'd like to share?
Well, I just want to say thank you from the bottom of our hearts. I've talked about the couple of different ways we've been able to leverage your in-kind gift to hard dollar gifts with others. And like I said, one of them is in perpetuity, and that doesn't happen. Nonprofits don't typically get that. So I mean, it's changed her life. It's changed Rosa's life. And going from, a patient to that person on the front line that can relate to our patients and is scheduling them, and to be able to, tell them, if they have any fears or share with them her experience or things like that. It's really incredible. So the story of Mend for us is very much an affirmation of God being in the details. And like I said, answering prayers that we didn't even ask for, to be honest, or know that we needed. And it's encouraged us, and it's been an incredible blessing to our patients. So really, I just wanted to say thank you.
Yes.
Yeah, you're so welcome. And we are just so grateful that we can play a small part in this. Matt, is there anything you wanted to say before we close it out?
Yeah, I know that we had talked about this as well, but there's a lot of new enhancements we've come out with. So we want to continue to support the Grace Medical Home. So I think where we're going from here, I think there's other features. There's patients don't need apps anymore. Yeah, I think there's a lot of ways that we could add value. So I think we're going to continue that implementation process and review everything and see other ways we can make life easier, because I think the more we can automate administrative burdens, things of that nature, that's more care that can go towards the patients and the community and the people that you serve, or raising funds, or all sorts of other work. So we want to continue to support Grace, and we're grateful for the opportunity, and that together we were able to make an impact.
We can't wait. That'll be awesome. Thank you.
Thank you so much. And thank you on behalf of our patients.
You're very welcome. Well, Stephanie and Liza, thank you so much for your time and sharing your stories with us and the audience today. We just gratefully appreciate it. And for everybody watching, if you have any questions or comments, please feel free to hit us up down below. In the next episode, we will have another great digital health thought leader for you. Please make sure to like and subscribe. And thank you very much for watching.
Thank you for watching today's episode from the Getting Down with Digital Health podcast. To learn more about Mend or to access more content, please visit mend.com.